Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuroimmune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendal Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hello, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing you an episode on brain fog. But first, you may be wondering, where has Dr. Stewart been? He's been a little MIA lately. And so, Dad, you want to tell the people where you've been?
Well, I got my knee replaced.
Wow.
Okay, so,
how was that?
A little bit tougher than I expected, but I did really well. I'm about 7 weeks out now.
Awesome.
I'm able to work out. I did try to play some golf the other day and did fairly well. And I prepared really well for it. It came over it. I just think that it's a little bigger surgery than some people expected.
So what did that preparation and then the recovery all look like?
Yeah, so I prepared really hard for this. So I was using peptides. I was using great nutrition. I was using a little bit of testosterone therapy just to make sure I had plenty of energy to do it. And certainly my vitamin D and other mitochondrial things. And then after I had the surgery, it was about a 3-hour surgery, I think. And I got my glutathione beforehand. And so my glutathione, I woke up from anesthesia with no brain fog.
That's awesome.
Great concept, right? And I also used some exosomes and some peptides to essentially maximize my healing.
Yeah.
And my therapist told me that I healed faster than anybody she knew. So one thing you got to do is make sure you do therapy on it.
Yes.
Make sure that you,
Physical therapy.
you just got to have yourself pushed a little bit.
Yeah.
So I did have one little complication with my anesthesia. I had a block on my leg, and which is only supposed to block the feeling, but it made my leg not work for about 24 hours, and that was
not fun.
concerning to everybody. But then I got a glutathione, and I bounced right back. So, I like to practice what I preach. It turned out that, my scar is pretty much non-existent now, and I would encourage everybody, if you're going to take on something elective like mine, because this was something I didn't have to do, but I did it because I want to stay very functional.
Yes.
I got mad when I couldn't ski on that leg. And so it really worked out well. It's nice to have a functional knee and know that I'm going to be doing well from now on. I don't know if I'm going to jump into the other knee anytime soon, but you do have to realize that I tried to go without pain medicine. That was a huge mistake.
Yep.
Yeah. So I wound up taking pain medicine kind of regularly for about 5 to 7 days. And then I just went to anti-inflammatories. So, knowing my genetics, knowing what I needed beforehand, practicing what I preach, which is sometimes hard for doctors. We're not great patients. I can tell you my wife got fed up with me.
Yes.
And that's just can be expected because us men, we're not the greatest patients.
Yep. Takes more time than you think.
And here's one thing I've really learned. I'm not good at laying in bed.
No.
I am not.
No, we were made to move.
No, I just cannot stand it. In fact, it was very frustrating. So I realized, man, I don't know if I need to retire anytime soon because I'm not really good at sitting around doing nothing.
No.
So anyway, my grandfather used to say every man needs a ranch. And what he really meant was every man needs a reason to get up every day and have something to do to keep himself healthy and busy. And I totally agree now.
Yeah, that's wonderful.
So
that's
so
insightful.
Awesome. The Lord helped me a lot. Blessed me in a lot of ways. Okay.
That's awesome.
Yeah.
Alrighty, so we want to get into the topic of brain fog. I know that's a big thing. In our day and age, there's so many, everybody deals with it. Everybody has dealt with it at some point, whether it's every day, whether it's weekly, whether it's monthly, whether it's only around certain things. And so we really just want to dive into the topic of what is brain fog, what actually causes it, and how are we going to treat more than just the symptoms of brain fog?
Sure. So brain fog itself is just, everybody knows what it feels like. It's hard to define it, but basically it's this, that your brain is not as sharp in its cognition, sometimes in its mood, sometimes in its precision, its memory, recall, things like that. But really what it's about is you just know your brain's not optimally functioning.
Yeah.
Okay. And so basically, everybody wants to know, especially as they age, we all start getting worried at my age about secondary things that could be coming, which none of us want, which is the dementias, Alzheimer's.
Yeah.
And so brain fog, I mean, I'll have 40-year-old people come in and worry about it, especially if their parents have had some issues. But if you ever look on the internet and you read from, good sources, Cleveland Clinic, Johns Hopkins, et cetera, what they tend to do is list things that are associated with brain fog, not really the causation.
Yeah.
And, we're everything about what we practice is about causation. And so causation is something that is really number one in my mind. I've got to get to the source of the problem. And so what you'll read about is, too much screen time. Poor sleep patterns. Too much stress. I mean, but as a doctor, what are you going to do? If I tell you, you need to de-stress your life, well, good luck with that. You need to sleep better. Well, how do I do that?
Yeah.
You need to, diet plays a huge role in it. I can tell you the times I get it, I have done poorly on my diet the day before, almost always.
Too much sugar, too much gluten,
Absolutely.
too much dairy.
Like Thanksgiving is a nightmare for me. The next day I'm pretty much
for
worthless.
Everyone. Yeah.
That's because I'm a pie man, so I love pie. And so I'm going to eat 2 or 3 pieces of pie. It's just the way it's going to be. And so the problem is the next day I'll suffer from a brain perspective. So you don't want me treating you the day after Thanksgiving.
No.
So, okay. Now, with that being said, though, those are not causation.
No.
Those have nothing to do with causation. And you'll hear about hormonal changes. You know that women get these a lot around menopause.
Yes.
Postpartum is huge around your cycle. And then there's a big difference between occasionally getting brain fog and then people who get into chronic brain fog.
Yeah.
And so I think we need to separate that and really kind of dive into what really is the causation of it. Because there tends to be, in my mind, about 5 major causation issues. And if we can address those 5 major causation issues, we can probably get to the source of the problem so that when you do have poor sleep, high stress, bad diet, the chance of you getting it and bouncing back quickly or not getting it at all should improve significantly.
So it's usually an underlying issue that then
has to be.
is making everything else worse.
Well, always remember, the brain is the highest energy organ. Frankly, what is the only thing in the body that has to sleep? The brain.
I was like, wait, let me think about this.
There's a reason and an order. Now, that doesn't mean we don't use any energy when we're sleeping, but we're recycling our energy. We are shutting the cell down into a less energetic state. And so when you get into problems with energy or lack of energy or something that is draining our energy, the brain's going to be one of the things to suffer. It just will. Yeah. And everybody knows it. If you've been sick, you don't want to do something super important with your brain when you're sick. Now, the concept of brain fog, everybody knows they have it. I can tell you as a general rule, doctors never want to hear that.
Yeah.
I mean, it's basically they don't know what to do about it. So they come up with stuff like, change your diet and remember, you got to spend a lot of time and a lot of effort to get to the source of these problems. Yeah. This is not an easy thing for a doctor to do. But the way I like to think about it, the number one cause of brain fog is inflammation in the body.
Yes.
And the problem that people don't understand, so let's say I'm having a cycle for a woman and my uterus is inflamed, well, that's going to affect my brain, and everybody knows it. Now, men, we don't recognize that because we don't have the pleasure of having that monthly issue.
Pleasure.
But I understand. Obviously, we don't like it either. Trust me. But in general, what we can tell you is that inflammation anywhere causes a problem. So if you've got inflammation in your bowel, you've got chronic infections of some sort, whether it be viral like Epstein-Barr or other things, whether it's a UTI, a chronic UTI, chronic sinus infection, whether it's even some things that are more chronic diseases like Lyme's, et cetera, those types of things can really create brain fog that goes along with it. Yeah. The second thing, and we can talk about each of these individually, but the second thing is going to be mitochondrial energy. your mitochondria can be affected not only by not getting glucose into the cell or insulin resistance, because the mitochondria runs off of glucose. And the only reason I mention that is insulin resistance is such a huge problem
Yeah.
these days. You know,
Yeah.
it's probably because our Western diet is so carbohydrate laden that when you expose the insulin receptor to higher levels of glucose over long periods of time, you don't necessarily have to have diabetes, but if you eat carbs 5 or 6 times a day, you're exposing it to higher levels of glucose and it will become less sensitive.
Yeah.
And so that creates insulin resistance. And then we've talked about before autophagy or the cell building up debris
Yeah.
and keeping, blocking essentially glucose. But we also have toxin load. Toxins, those chemicals love to get in the mitochondria and mess it up. And frankly, I like to say that if you sit around a table of 90-year-olds who have old batteries, the high energy organs of the body are your eyes, your ears, your brain, your endocrine organs, and your immune system. So if you sit around a table of 90-year-olds, how good are their eyes? And how good are their ears? And how good are their brains? And how
Yeah.
good are their hormones? Well, it makes common sense, but when it starts happening in your 40s, there's something wrong,
Yeah.
which means we have a genetic weakness.
Yeah.
Now, we can also get brain fog from not having the right vitamins in them, methylation and methylfolate in particular, which helps make dopamine and serotonin and is used in the mitochondria, is very, very important. And so your doctor has to be able to start walking through each of these issues with you and determine where is the problem. And because some of my patients will come in, they're absolute disasters. There's a problem with all 5 of them.
Yeah.
Okay, so that's kind of my concept. I can tell you that it takes a lot of time for a doctor to work through that stuff. You're not probably going to get it down with your family practice doctor because he just doesn't have the time to work through it. So in general, we always take it as a sign of not being healthy. And so brain fog is a big deal to us. And if you've got brain fog and can't do cognition and everything, I will guarantee you there's anxiety
Yeah.
and sometimes depression and everything else that goes along with it.
Yeah.
Certainly a higher sense of worry
Yeah.
overall.
Yeah. So would you say there's a difference in the brain fog that someone with a chronic illness can get versus just like the everyday individual? Is it all just within genetic predisposition? Is it all based on your lifestyle or like?
I think it's certainly a combination of all things. Now, people who only get it at certain times, what that to me means is that nutritionally, genetically, they can bounce back.
Okay.
Which means they dive into it, but they know that after whatever's driving it passes, they come back out of it. That can be remedied.
Okay.
I like it to see it then, because if I see them then and I can maximize their nutrition, their health, change their diet, get rid of inflammation, they probably will not have near as many episodes.
Yeah.
But if I have somebody who's chronic, that means we've got a chronic disease state that's essentially stealing. Because there was one time in my career I made the bucket theory, and the bucket theory is basically 4 buckets that you essentially fill, and you fill it with these nutritional elements. Now, the energy bucket is the first bucket. You got to stay alive.
Yeah.
So we'll always use nutrition there. And then we spill over into basically our immune health. We have to have something to fight or we're going to wind up dying. And then we have the dopamine and the inflammation bucket, and that inflammation bucket will drain it pretty hard. And then the last bucket is focus, concentration, organization, what I call the dopamine, serotonin, norepinephrine bucket. So the problem is what happens is you pour in a certain amount and you'll feel the first 2 buckets, but if one of them starts draining real hard, the one that really suffers is the last bucket.
Yeah.
And that's your focus, your concentration, your organization, your high level functioning bucket. I feel good. I'm healthy. I can tackle the world. And so when you get into a chronic disease state where the immune system's turned on or where there's excess energy, and basically that's what stress is. Stress is basically excess energy expenditure from your hormones and everything else, then that last bucket just will never be full, and you're in trouble. Yeah. And if you don't get help, you're not going to come out of it. People just hope they go around, and and everybody will have their advice. You go to the internet and they'll have this, well, you need to start exercising. Well, if I don't even feel like, if I haven't, well, let me back up. Let me give it another analogy. Let's say I make $2,000 and that goes into my bank account every month. Okay. If I don't adjust my spending to be under $2,000, I'm going to bounce checks. Yeah. Okay. So what people don't understand is that is genetically predisposed. It is nutritionally predisposed as to what you're essentially stealing or taking from the supply. And so the only way to overcome a deficiency, if I have to write more than $2,000 in checks, is I've got to make more money. Well, in health, that's really the purpose too. I've got to have some way to improve the functionality of the system, but I've also got to have supplies that are there to do it. And so that's the biggest problem, I think, with diet for most people, because the first thing you think of, and people typically call this food addiction and sugar addiction. But what they're really trying to do is they're telling you that their brain is running out of energy, and energy is made from glucose. And so I don't want anything but glucose because that's what my brain's telling me I need. And so it becomes a very frustrating deal. In fact, I have arguments with my trainer, Bain. You guys have probably met him before here, but his old concepts is you just got to eat better and you got to work out harder and all that kind of stuff. And I'm like, dude, sometimes that's just not possible for people. Yeah,
because there's people who do that and then still get brain fog.
That's right. And so what we have to do is we have to, as doctors, have some objective, scientifically validated way to see what's missing. Yeah. Because you also don't want to go to the doctor and they put you on everything under the sun and you're spending a fortune and they're just guessing. You want to know exactly what you need and exactly what you don't need. And that's the power of genetics. Yes. Blood testing can tell you what's in the blood. And there's times when you need it. You need to check. We'll talk about the protocol that we go through to try to ascertain exactly what we need. But it's got to be a very precise, cognitively focused, or treatment-focused process to bring them out.
Yeah. Why do you feel like why do you think people usually get brain fog in like the afternoon or the evening compared to like when they first wake up in the morning or throughout the morning?
So I think it's really an energy thing. So think of energy. Well, think of a 3-year-old. Okay. Now, high energy in the brain is calm, cool, collected. Yes. So we were just on vacation with all your nieces, right? 4, 2, and 9 months at the time. And they wake up in the morning and they are sweet and they're cuddly and they do everything sweet. What happens at the end of the day?
They go crazy.
That's right. They go nuts. And so low energy in the brain is fog, turmoil, anxiety, distress, overreaction. Okay. And so I think really what that's about is that you have a certain amount of energy programmed into your system every day, and that when you tend to run out, I think that's when things become the worst. Yeah. And a lot of people have actually adjusted their lifestyle to that low energy state. Now, if you go to the doctor and you tell them, I have brain fog, you know what they're automatically going to do?
What?
Stick you on a stimulant.
Yeah. Why?
That's because they think, we've just got to stimulate the brain to squeeze out more neurotransmitters, or we're going to put you on an antidepressant, or, understand? And that's really, from a chronic brain fog standpoint, that might get you a little relief, but all of a sudden you're squeezing the same supply extra hard. And so when that medicine wears off, you're not just going to have brain fog, you're going to have brain exhaustion.
Yeah. So what about the people that are already on those types of medications then?
Well, they're probably on them for a reason. So, and some of them, and the classic thing is once it quits working, let me raise the dose.
Yeah.
So I'm squeezing it extra hard. So I always like to think about, I call it a big toothpaste tube.
Yeah.
The toothpaste tube, and it's full of neurotransmitters. So if you take a stimulant, and of course I drink coffee every day, so I'm using a stimulant, which is caffeine. Some people use nicotine. Some people use prescription medicines, but we're squeezing that tube hoping that dopamine and other neurotransmitters come out. Okay. The problem is if we're not refilling that tube, eventually we squeeze that tube to where it's flat, and you can squeeze it as hard as you want now. Have you ever had that toothpaste tube you can't get anything out of? And the problem is once you get up into higher doses of those, that's when you start getting a secondary side effects.
Yeah, because your body doesn't want to make those anymore because you're getting external
stimulation. Well, they're just not capable because the underlying genetics were already there.
Yeah.
Okay. So ADD is actually a proper state for the brain. What it's saying is I'm not functioning as well as I should, so I'm at higher risk when I'm out in the woods to get eaten, so I'm going to heighten my awareness of everything around.
Do you want to explain that analogy again for the people?
Sure. So most of what we call abnormal states or symptoms a lot of times are actually proper states, and particularly in the brain. And so if I am not functioning as well, focus, concentration-wise, my brain knows it, and it knows that I'm more susceptible, especially the way we used to be. This modern world's a little different than how we were essentially designed. We were supposed to be in the woods, and there's bears and lions and all that stuff. So what God has in our brain is what's called the magnocellular system, which is your hyper-awareness system. And so basically that system, when it senses the brain's not functioning well, will be turned up. Now, you and I right now, if our hearing is normal, we're using 50% of our hearing. That system, when it gets turned on, will recruit the remaining part of the nerve, and we'll start using 100%, which is like you and I listening to a bullhorn.
Yeah.
Okay? It heightens our peripheral vision. It heightens our hearing sensitivity. It heightens your smell. Most pregnant women will recognize that because their smell. And so that heightened awareness means I want to hear the bear, see the bear, smell the bear way before everybody else so I can have more time to get away. And we call that ADD.
Okay. Yeah.
Or ADHD in boys who can't sit still. And so we treat it with a medication trying to squeeze more dopamine out. And the problem is really there's not enough dopamine in the first place. So why don't we just fix the problem? Well, we become aware that there are several different causes to that. And if we can overcome the deficiency, we don't need the medicine. And I won't even get into that discussion because, our standard classic Western medicine care is based on treating the symptom, not treating the problem. And so in general, that hyper-awareness is actually perfect for the woods. It's just not perfect for the classroom. And if you've ever been in an elementary school classroom, it is not a quiet place. Everybody's moving. And so how are we supposed to expect that these young men will, in particular, are going to be comfortable and going to be learning when there's all kinds of clicking of pens and shuffling of feet and going on around them. So brain fog, and I can tell you if you talk to those ADD people, they have brain fog. They don't feel like their brain's working right. And the medicine, a lot of times they don't really like it. They don't like the stimulants. They might function a little better if you got the genetics right, but they just don't like it. And so in general, I'll tell you that I really wish we would focus more on getting to the root cause of the problem.
Okay, so back in January, I had actually gotten the flu. At least that's what I think I got. And then like a few weeks afterwards, I was getting really bad brain fog, or it's more so just that I wasn't able to get my words out clearly and like wasn't able to think as well as I usually am able to. And so what do you think? Like, what about people who have brain fog after getting sick? Or what about the people that have long COVID?
Right. So immune activation of any type, whether infection, is going to set off inflammation in the body. Now, remember, the immune system will not only work inflammation locally, but will release chemical messengers. We call them cytokines. And they essentially tell the body to be aware from an immune system standpoint so that the body is kind of primed from its immune status to protect from the infection everywhere, and that includes the brain too.
Mm-hmm.
Now, more than likely in this day and age, you probably, if it lingered afterwards, you probably didn't have the flu. You probably had COVID.
Yeah.
So COVID variants now, there's a process in all viruses called antigenic shift, which means that every virus, luckily the way God allowed them to be, and I say allowed because I think they're tools of the enemy, but that's my personal feeling. But in general, what I'll tell you is they become weaker antigenically as they mutate. So they never become stronger.
They always become weaker.
They always become weaker. So what COVID is now is something that is not as severe as it was. And now that we have immunity either from the vaccine or from catching it, we basically have, we get rid of it quicker and easier, and it's not near as noticeable as it was. Now, the problem with that, though, is that the spike protein that's still on that COVID loves to get into the blood pressure receptor and break off and stay there. And so there are some laboratories you can obtain where we can actually see the number of spike proteins left in your body. And the problem is, let's say you get a splinter under your skin in your foot and you can't get it out. What happens?
Stays there.
Stays there, and you make a little pus pocket around it, and we call it your body's trying to push it out, right? Well, that's essentially what's going on with the spike protein. It's a foreign body. It's not supposed to be there. It's sitting in there in your blood pressure receptors and causing inflammation of chronic nature, which will cause long COVID, which almost always includes brain fog. Okay. Now, we have many ways to deal with it. We have certain enzymes that can break it down. We have certain, if it's really bad enough, we literally can wash your blood and remove your plasma that has the spike protein in it. But in general, what you're seeing is long-term inflammation that's giving you trouble. Now, when you have inflammation, God has given us steroids naturally to fight that. The problem is cortisol is the short-acting steroid, and that goes away pretty quick. You really don't have more than, I would say, a week at the outside of your cortisol really keeping up with that inflammation. And then you have progesterone, estrogen, testosterone, and other steroids. But vitamin D, you have that too. And the reason a lot of people's vitamin D is so low is because they're chewing it up as fast as they can make it. And so in general, when you start to age and your testosterone starts going down in menopause, your progesterone starts going down in perimenopause, or you are on birth control pill and you've basically knocked your progesterone down, you really don't have any way to fight that inflammation. And so it becomes a long-term deal. And so overall, we have to pay attention to the infection. We have to pay attention to what we call the sequelae, or the results of the infection, which may be a piece of something left in it, or a hidden infection like Epstein-Barr or the herpes viruses, like Lyme's and their co-infections and other things of that nature. And we try to get rid of the infection, but that chronic infection will drive the brain fog. And so a lot of times people don't know that they have those disorders until you go and you check them. But they will come in with brain fog and not feeling good. And
so, like, with women, so I know, like, during menstruation, our estrogen and progesterone is really low, right? And so is that why we would tend to get brain fog? And then how is that different throughout, like, pregnancy and
there's two things that go on. So about 3 to 4 days before, in normal menstrual cycle, 3 or 4 days before your period, your progesterone will fall out. Your estrogen will stay high. And so that estrogen dominance also creates swelling. It creates water retention. That's why women swell. That estrogen dominance. And all that means is the estrogen is much higher than the progesterone. It's not balanced. And that estrogen will also create kind of sometimes some kooky thoughts in women's heads, and their emotions are out of hand, and they're crying at commercials, and they're hyper emotional. Now the problem is if you're prone to that, unfortunately your progesterone starts going down probably about the age of 35. You understand? And eventually, when you get into your early to late 40s, it's already so low that then all of a sudden, instead of just having it 2 or 3 days before, you're having it on a
Yeah.
constant basis. And so, in general, checking your hormones is very, very important. And we'll talk about that in the treatment phase. But that's why so many women suffer from cognitive problems in their 40s, beginning in their 40s. And if their parents have had problems with dementia and stuff, they're going to be coming to your office freaking out that they're going to get it.
Yeah. Yeah. So then what about women during pregnancy and postpartum?
So postpartum, and this is one of my questions for God. I don't know if you know I have a bunch of questions for God, but you have this super high progesterone level during pregnancy.
Yeah.
It goes to almost 4 times the level that it is during
to sustain
a
the
normal
pregnancy.
cycle. And then as soon as you deliver that baby, it comes crashing down to almost nothing. Okay, now that reduction in progesterone not only has anti-inflammatory abilities, it has GABAergic abilities. And so GABA creates contentness. Lowering that progesterone, your GABA goes away very quick. Your brain tends to race, and you just have this newborn baby. You're not sleeping well. I mean, postpartum is a really rough time.
Yeah.
I'm sure God's going to have a great answer for why that happens, but the problem is that will certainly create a little bit of estrogen dominance. So you get the swelling and all that other stuff, but it also creates a significant amount of brain fog. So postpartum, but it also creates the dysphoric disorders too. You know, the postpartum dysphoric disorder like anxiety, depression of postpartum. That's why so many women suffer from that.
Okay.
And I will tell you that preparing for that for women is very important. Meaning, if you can have the time to see the woman during pregnancy, look at their genetics, prepare for that postpartum process.
Yeah.
You certainly don't want to do anything that's going to change her milk production or anything postpartum, but you got to prepare for the problem. And then typically when women eat more cleanly afterwards and are prepared to expect this type of thing, we can help them through that process, and we'll certainly get a lot less of the brain fog. You know, there is a wives' tale that says you lose half your brain with every pregnancy.
Yeah, the pregnancy brain.
Yeah, and it's a real deal.
Yeah.
I mean, women will tell you that. And so a lot of times you may not notice it on your first pregnancy, but boy, that third pregnancy is almost what I always hear, that third pregnancy. I just changed after my third baby, especially in the women who started a little bit later.
Yeah.
And so I will tell you that, brain fog is not fun. I don't have to tell anybody that, but it really is a sign of something wrong underneath. And that's what doctors don't want to really recognize. You know what? The doctor loves, if you're a family practice doctor, you want it to be a UTI and here's your antibiotic and I'll see you later. And I don't mean to criticize that. It's hard to be a family practice doctor and try to be knowledgeable in all these different areas, but you've got to have somebody who pays attention to the source. Yeah. Because if you go to the psychiatrist, you're probably going to get put on a medicine because they're going to see it as a psychiatrist does. So in this situation, I really think a functional type of doctor who can really look at the sources of the problem and adjust it in a bioidentical, natural manner, I think is probably the best approach.
Yeah. Yeah. So earlier, whenever you were talking about your knee surgery, you said that you were getting the glutathione IVs, and then after anesthesia, you felt way better. Yep. So, but what about the people that get that post-surgical brain fog?
So the glutathione not only removes toxins, which is its purpose, but it also has an anti-inflammatory property.
Oh, okay. Okay.
And so God never does one thing with one thing. He does a lot. And so glutathione also has a way to kind of perk you up because glutathione's made of 3 amino acids, and one of them is glutamate. And so it has this perking effect. And in fact, some people will almost get high on glutathione afterwards. It's really your older brother's one of those people. And so the long and the short of it is if you prepare to remove the toxins because you know you're going to have a problem. You prepare to, now you don't necessarily need it before anesthesia of pregnancy. We
Okay.
would probably do it afterwards,
Okay.
you know, and because glutathione's bioidentical, we don't have to worry about passing anything to the baby
Yeah.
in the breast milk or anything like that. And what we really want to do is know how you're built so we can take care of the suspected issues before they happen.
Mm-hmm.
You know,
Yeah.
prevention is way better than
Yeah.
putting out fires.
And I know we talked a lot about that in our IV podcast.
Absolutely. And so for me, it was all about prevention. I didn't want to get into those issues.
Yeah. Okay, so one more thing I want to do before we get into treatment is talk about concussions.
Yeah.
Because you're Mr. Concussion
Oh,
specialist,
I
and
love
so,
concussions.
well, love.
Love. Well, so here's the problem. It's pretty evident if you've treated a lot of them. Number one, if you get a mild traumatic brain injury, is what we call it, or a concussion, you really look pretty normal on the outside.
Yeah.
But on the inside, your brain
Yeah.
is not working well, and that's why we have so much trouble, and that's why we need such sophisticated equipment
Yeah.
to check people to prove that where the concussion occurred, did it occur, how bad was it, and so we can focus on the recovery. Now, concussions there's two big problems. Number one, when you hurt the brain or even the sensory systems, the inner ear, the eyes, the muscular system, the nerves from your peripheral system, whenever you hurt them, all they know how to do is work hard. They can't rest because theoretically, if you got a concussion in the woods and you had to rest, you would probably be eaten by the bear.
Yeah.
Okay, so God made it where he floods glutamate from the brain when you get a concussion, which makes you hyper aware and keeps you hypersensitive. But that also tells the brain to work at a high rate of speed, and it starts burning out its supplies. And so in concussions, you will find out that there are two types of people. There are people who are genetically programmed a little different, who can get a pretty bad concussion and they can bounce back like very quickly, usually within a week or 2 weeks.
Wow. Yeah.
Then there's another whole group, which is the ones that I always wind up seeing, that no matter how hard they try to recover themselves, doing everything they know, they cannot do it. And those are the genetically insufficient patients.
Okay.
There is something missing in their ability to recover. Okay. And that's what's the problem, because when we study drugs and things, we throw everybody together that's all genetically and assume they're all genetically identical, and they are genetically completely different. And that's what's so frustrating. You cannot compare an apple to an orange. It's kind of like saying, we're going to study this in fruit.
Yeah.
Okay. No,
can't do that.
a banana versus an apple versus an orange is a big difference. Yeah. Okay. And I know that's a silly analogy, but that's how we do it. And I don't agree with that at all. And so in concussions, when I see the people, we know that they have lingering symptoms that cannot be resolved. And so what we know that brain fog is always part of that, always. Now, the problem with a concussion, though, is that we actually have two types. We have a brain concussion where we actually hurt the brain, and then we have a vestibular concussion where we hurt the inner ear. And one's a software problem, one's a hardware problem, or we have both.
Yeah.
And so you've really got to fix the two problems, and those are both high energy organs, need a lot of energy to recover, need a lot of help. And frankly, you have to assist a lot of those patients in recovering. But that brain fog can literally persist in perpetuity unless you do something about it. Meaning that if we have a bad methylation deficiency and they don't have methylfolate, they cannot produce enough dopamine or serotonin to return to normal. They cannot produce enough energy and the mitochondria to return to normal. So we have to intervene in those people. If there's inflammation that continues afterwards, I mean, my knee, if I overdo it, it will swell, and it doesn't function as well the next day. And so we shouldn't be surprised by these things, but we've got to jump on this and know exactly what our problems are. And we've got to be very methodical in our methodology, in understanding that we not only can find what the problem is, but we can also find all the causes of the problem. So when we talk about treatment, I want to discuss the things that are actually required, because a lot of doctors will just measure a thyroid and their thyroid's a little low and they'll say, oh, it's your thyroid.
Yeah.
Well,
And then,
that
yeah.
might not be the
And
whole
that's the only
story.
thing.
Yeah. Okay. And so concussions are a big deal. If you've had it, if you don't take care of it, you are at higher risk for Parkinson's and Alzheimer's and all the other degenerative diseases as you go. So you have to see a doctor if you have that persistent form of post-concussion disorder.
Okay, so now I want to jump into treatment. So when
Okay.
it comes to treating someone with chronic brain fog, or brain fog just from concussions, from all these different things, are there different steps that you take? Do you go an overall approach? Like what do you do in treatment?
Well, a little bit of it has to do with the age of the patient,
Okay.
the past history of the patient. So I can tell you that, so I had a girl, she was 15 at the time,
Mhm.
got hit in the back of the head with a golf ball.
Yeah.
Okay, got a concussion. And basically, nobody really believed her. They thought she was just a histrionic, hyper-excitable 15-year-old girl.
Mhm.
And, but the problem is she really did have this post-concussion syndrome. And then what happened is, essentially because she had already had this deficit in some genetics that really was not allowing her to heal, she started draining the resources even more,
Mhm.
and then progressed into a severe dysautonomia where the automatic nervous system doesn't work right. So increased heart
Yeah.
rate, bowel problems, and all these things. And then got into massive chronic fatigue
Mhm.
because then she had an activation of a virus that had already infected her. And so she got into chronic fatigue, and then basically got so severe that she even then set off some chronic pain syndromes and wound up going to the hospital in Fort Worth and spending weeks in
Yeah.
the hospital, and went through all these treatments and still was not better.
Yeah.
And I'm telling you, she went through a ton of treatments. Now, the nice part of the story is I finally got to see her about, probably 18 months after
Yeah.
all that started. And what happened is when we finally said, okay, well, this is not just a problem with the concussion, this is not a histrionic girl. Let's dive into the process. And as we went through the process, we were able to find exactly what was wrong with her. And we were able to recreate an environment where she came out and now is thriving and has a great story to tell. And I'm telling you, they've probably sent me 20 patients
Yeah.
since then. And
Yep.
they tend to be all young females,
Yep.
because there's a lot going on in the female body
Mhm.
during those time frames. But in treatment, the way you have to approach it is very straightforward.
Okay.
Now, almost every doctor will get blood work, and I do think that's very important. You got to find out what the hormonal levels are,
Yeah.
in particular for thyroid, because remember, the brain's a high energy organ. So we're going to need to make sure that they don't have an elevated A1C or not getting hypoglycemia.
Mhm.
We want to make sure that their thyroid is functioning well so we can create it. And I don't mean just well in the normal range. I mean, it needs to be the middle of normal,
Mhm.
and it needs to be checked right. We need to make sure we're checking free T3, okay, in the thyroid, so that we can get the proper conversion, because there are people who have genetic problems converting T4 to T3.
Mhm.
And for those who don't know, T4 is the pool of thyroid,
Yeah.
T3 is the active form.
Yeah.
And then we also have to make sure that we have blood counts that are normal. We can check by looking at the red blood cells. We can find out if we're missing B12 and other things that assist us in recovering. After that, I like to go to a genetic test. A genetic test tells me what I need to do and what I don't need to do from a supplementation standpoint to assist that patient. And so genetics focus our expense and our effort in the areas that we need it.
Mhm.
And so what we typically want to know from a genetic test is how bad is the inflammation and what is their ability to turn it off? Because if they can't turn it off, then
Yeah.
we have to turn it off for them. Lately, we've been very effective at turning off inflammation with a natural peptide called thymosin alpha 1.
Mm-hmm.
Thymosin alpha 1 is made from the thymus gland, which is a gland in your neck
Mm-hmm.
that is very prominent when you're a young child.
Yes.
And you tend to lose it as you start aging and it goes down. And some people have higher levels than other people. So people who have lower levels of thymosin, their T cells, the cells that kill chronic infections, don't tend to activate or work as well and can get worn out. And so by putting that back in there and bringing the T cells back, we not only kill any infection or any process that's going on, but it tends to balance the B cells so we don't create as much antibodies and as much inflammation as general.
Oh, okay.
Basically, God designed it. If I can't kill it, I'm going to inflame the heck out of it.
Yeah.
And that's how he does it. And then we want to also look at insulin resistance in its context. We can use some genetic markers. We can use some blood markers. Want to make sure we're delivering glucose because remember, this girl, for instance, she was 15. Well, she needed 4 times more glucose than any full-grown adult. And I'm talking after 25 because that's what happens in teenagers.
Yeah.
They're growing so fast, they have to have better ability to deliver it. And so you'll need some supplements like D-chiroinositol to help the insulin work better. Occasionally, we've been very effective with tirzepatide in microdoses if we need it. And it's about making sure we're delivering enough glucose for energy need. Okay. The third thing we really have to do is find some objective measurement.
Okay.
Objective measurement of recovery.
And what do you mean?
Okay. Now, that's where things become difficult.
Okay.
Okay. I would prefer a cognitive function test. Okay. So in our bad concussion patients, for instance, we use what's called an Oxford concussion protocol. And basically, it takes you through an hour-long test where you have to remember things. And we like to have some objective indicator of improvement,
Okay.
which means we are actively improving it. Now, in regular brain fog, that's not necessarily available. We also have tests like QEEGs and other things like that that we can do that we can show a difference. But in brain fog, a lot of times you got to rely on the patient,
Yeah.
and you've got to believe them, and that's the problem in a lot of doctors. They don't really believe them. So we'd love to have something objective to measure. I'm a big believer in making sure we pay attention to the immune system because we are seeing a large amount of autoimmune diseases now that are aimed at the brain. And so those can also create significant brain fog. In fact, I've had numerous patients that have anti-dopamine receptor antibodies on their diagnostic tests that are contributing to their cognitive decline and everything else. So that's a whole different discussion and how we'll deal with that. But you have to be aware. Now, the third thing that's also, I can't stress how important it is, and that is diet.
Yeah.
Okay. And GI health.
Yes.
Because the easiest way to get into a chronic problem, even without genetics, is to have a bad gut. Whether you're having overgrowth, SIBO, or whether you're having just food allergies, et cetera, you've got to get a handle on that. And you've got to change that lifestyle and that dietary, not only intake, but you've got to change the environment of the intestinal tract. And so that requires genetics. In some cases, you can get testing, diagnostic testing. I will tell you, most gut testing these days is so complicated that really people don't know what to do with it. But you really got to talk about the gut a lot when you're talking about recovering brain fog, because if you've got inflammation in the gut, that is a huge organ that a lot of inflammation will certainly contribute to that problem.
Yeah.
So we will use things to calm the inflammation. We've got to be aware of biofilms if they're present, and we've got to do something to clear the biofilms if it's a chronic issue. We love genetics to help us with the gut, and will tell us whether we can use probiotics or not, because there's a lot of people you can put all the probiotics in and they won't work.
Yeah.
And so we've got to pay attention to that dietary component. And then you also need to have some essential vitamins tested to make sure that we have enough of the necessary vitamins to make the brain function well. Remember, it's an organ that works on magnesium, calcium, sodium, potassium, and even the trace minerals have a place in this type of thing. So whether you do that genetically or whether you do it through a blood test, you really need to focus on that.
Yeah. So what genetic panels would you recommend your patients to get?
So it depends on their symptoms. I mean, so what I would do when you're talking about brain fog, you go to a doctor and they just want to talk about your brain.
Yeah.
But I'm going to talk about your immune system. I'm going to find out what your gut's doing. I'm going to find out about your cycles. I'm going to find out about your urinary tract. I'm going to think about your sinuses. I'm going to think about hidden areas of inflammation. And then what we will do is we will target it based on the symptoms that patient has.
Okay.
So if you had chronic constipation or chronic diarrhea, or you just got IBS, or you find out your stomach hurts a lot, we need a genetic panel for the GI tract. And we need to find out what's going on, or is this histamines? If you have a tendency for your stomach to hurt after you eat certain foods, we may go and get a food allergy panel and find out, because in this critical situation where you're sick enough to come to the doctor for your brain fog, I mean, finding out what you're sensitive to and avoiding those for a while certainly is worth the effort.
Yes.
And I think you know about that really well.
Yes, I do. So what other panels if somebody's dealing with, whether that's poor focus, that's
Sure. So eventually we'll probably want a mitochondrial panel. If we're looking at small panels, we're going to want an inflammatory panel or an immune-based panel. And then we do want a neurotransmitter panel so we can look at how quickly a lot of brain fog is really not about you not being able to function, but it's in the brain. It's really interesting. Once you send a chemical from one nerve to the next nerve, what's really important is not how much chemical you send. It's how quickly can that chemical, that neurotransmitter, be removed from that binding site so another chemical can send another signal. So for instance, one simple genetic change called a COMT, the double mutation of abnormality is 14 times slower than a person who doesn't have a mutation.
Okay.
So if you have a COMT++, you are 14 times slower at removing that chemical from that binding site.
Okay.
So that's why some people are happy-go-lucky and can get over it in 30 seconds. And other people, once I'm done, I'm going to be mad at you for weeks.
Yeah.
So that all has to do with how you're genetically programmed. And we have ways to speed that process up. And so you have to look at all those little details to really maximize it. Because it's not just getting rid of the brain fog and getting back to clear mind. You may have found out that they were never really as functional as they could have been. Okay, which is probably going to be the case more times than not. And so you really want to maximize the ability, because once you get brain fog, it really becomes in older people a longevity issue. You're really trying to protect them from the things they're scared of.
Yes.
Because there's nothing worse than having a relative get into Alzheimer's or dementia or Parkinson's, and you'll just fret about it.
Yeah. So what supplements are you usually going to recommend for?
So it's all going to be dependent on the genetic test.
Course, yes.
So you want to focus it on genetics because otherwise you're guessing.
Yeah.
What we want is a scientifically validated method to tell you what you need and what you don't need. And right now, we really don't have that ability intracellularly inside the cell, except with genetics very effectively. And so we look at that. So if your mitochondria is weak, we use daily cell recharge to recharge your mitochondria better every day and help clean it out from its oxidative stress. If it is a COMT problem and you can't turn over, we'll use something like Full Focus.
Okay.
And Full Focus will help us with methyl donors. And so we target it according to what's necessary. And that's why getting the genetic test is so important, because It's only a one-time test.
Yeah.
You don't change it. It doesn't change.
Because you can always pull different parts.
And then there's timing involved, meaning there's sometimes we have to do this first, and then we'll see you back at 6 weeks, and we may do this.
Yep.
Because if you just look at the genetic test and throw them on everything, it's just not going to work.
Yeah.
There's a timing and elegance involved.
Yeah, and we went over that a lot in the inflammation podcast about you have to heal the body to then be able to put everything back in.
And the problem is with brain fog, if inflammation's involved, you got to heal the source of the inflammation, and that can take some time.
Yep.
Healing a gut that's in trouble
takes.
I mean, you're looking at a 3 to 6 months minimum.
Yeah.
Really to get that gut better. Depends on how disciplined you have with the patient. I mean, if they don't get off their Cokes and they don't get off their candy and their junk food and all that, I mean, you probably will never get it resolved.
Yeah. So back whenever we were talking about chronic inflammation and then whenever we were talking about long COVID and everything, you mentioned TPE really quickly. So I know we're actually about to do another episode on that. So could you give just like a quick
let me talk about that. So there are people that you work really hard on and you just cannot get them better. Yeah. Okay. And that inflammation is either driven by an autoimmune process, some type of chronic irritant like a spike protein in long COVID. And so there is some people that we work hard on and we just can't get them there. And so we actually have adapted a new technique for cleaning, essentially cleansing the blood, which is called therapeutic plasma exchange. Therapeutic plasma exchange is actually, we'll learn in that episode we're going to talk about, it's been around for probably 30 years.
Oh, really?
But there's been some significant advances in the quality of the machines and understanding a little better. But basically, we can take your plasma. So when we spin blood down, we basically create 3 layers. We create a red blood cell layer. We create what's called a buffy coat, and that basically contains platelets and white cells and all that. And then we create the plasma, which is where you have all the antibodies. Yep. You have the cytokines of the chemical messengers. And we have the ability to basically start an IV, take your blood into a closed system in a machine, send it in a centrifuge, separate it, pull off the plasma, and put in brand new plasma.
Wow.
Which is 5% albumin. And cleaning the blood has been a remarkably effective treatment for a lot of people.
Yeah.
Now, the other problem, though, is you can't just wash the blood and not pay attention to the problem that got you there. So washing the blood is a great option. It's a pricey option, but it works fantastic.
But how does it then help with long COVID or something?
So you're actually removing, so in long COVID, you're removing the spike proteins and you're putting in brand new albumin. Now, it turns out albumin is one of the strongest antioxidants in the body. And so when you replace it in these large volumes, because we'll pull off 2 liters of your plasma and put 2 liters back in plus, that essentially gives you a massive ability to control inflammation. And so it's just something that's been very effective for the people that we have trouble just getting them to heal themselves. Yeah. And we'll talk about it. I mean, I love TPE. It's pricey, so I wish it was cheaper. It's really pricey because of the products we put back in. Yeah. But in general, that's a very straightforward method that works great and can help us with chronic fatigue, long COVID syndrome, can help us with this general aging. In fact, there's a lot of people that are proponents of that.
Yeah. Yeah. I think that's awesome. I'm excited to get to talk about it.
Yeah, I've had it. And, I didn't, and we can talk about it, but I didn't expect to feel better, but I did. Yeah. I thought I was super healthy, but man, I did feel better. Yeah. So in general, that's anecdotal, but I can tell you that people that have it, and we'll talk about it in detail. It seems to be worth it. We just gotta see if we can mitigate the price a little bit over time.
Yeah. That's awesome.
Okay.
That's awesome. So I know we mentioned things on tummy trouble, and so we want to encourage y'all to go back and watch that episode. We mentioned things on chronic inflammation. So go back and watch our inflammation episode. We also mentioned things about glutathione and how that helps with brain fog. So we want to encourage you to go back and listen to our IV podcast as well. But overall, we just want to say thank you for joining us for another episode of Coffee with Dr. Stewart. Make sure you go and follow us on all of our social medias and be ready for the next episode. We love y'all and be blessed.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.